how can we look after fibroids if we're pregnant? What is the treatment of fibroids if you're pregnant? So of course we're going to talk about these, and I've got a few questions sort of lined out for us to look at. And the first one, as you can see from the banner here, is can you get pregnant with fibroids? And if so, are there any special complications? Well, that's what this whole video is about. We're going to go into that, okay? But I thought, so what this implies in the first instance is, does having fibroids mean you cannot get pregnant? So very quickly, I'm going to say from the outset, no. Having fibroids does not mean you cannot get pregnant. Let's go and let's share the screen again so I can get one of the images I promised I was going to share with you, and then we can have a good look. So I'm just going to share that one, and I'm just going to change the image. Okay, so I'll just double check that we're seeing the same thing. Yeah, okay, let me just remove that so that you can see clearly. Very good. So what we're talking about now is, does simply having fibroids mean that you cannot get pregnant? So the answer to that is no. Fibroids can have an impact on fertility, and we're going to talk about that. But just having fibroids, the blanket response to that is it depends. It depends, and it's important for you to know why. And the why is because there are different types of fibroids. In the outer layer, you could have what's called a subserosal fibroid. So the fibroid is growing out from the outer layer of the womb here, and it's going out into the abdominal space. You can have a fibroid that develops right within the muscle of the womb, and you can see that. So this pink here sort of represents the muscle, the womb muscle, and this fibroid is sort of within that muscle space. And this fibroid can go big, and as it grows big, it can go that way outwards, or it can go inwards into the womb itself. Okay, so but this is coming right from the wall of the muscle wall of the womb. Okay, and by the way, these are the ovaries. So you've got the ovaries here, just in case you're trying to orient yourself across this picture. That's the ovary and fallopian tubes. Okay, so that's the womb. So just going back to that, the third type of fibroid, and these are major types. I don't want us to get too technical so that we don't get confused. But the third type is the one that grows from within the inner layer. So that is, inner layer means the inner cavity where the baby will sit if a woman is pregnant. So right in here where my cursor is. And so you have fibroids that are entering, that go into that layer, like this one up here, or you can have this one here, which is sort of going into the vaginal canal. Or you can see how quickly or how easily this can affect a baby that's growing in here. So when we ask ourselves the question about whether fibroids can affect, or can you get pregnant with fibroids? Yes, you can. It depends on where the fibroid is. So that's why we talk about the type and the location of the fibroid. If you had one that was sort of growing here, if that was all you had and all these other ones were not present, then pregnancy is possible. The baby can within the womb, inside the womb here. The problems that the person with this type of fibroid might have is, as it grows bigger, it might press against other parts of the other organs and cause pain. It might twist around itself, cause pain and bleeding, things like that. But not that it will affect the ability of the baby, of the pregnancy to plant within the womb cavity, which is what might happen if you have one like this one, or the submucosal one, sorry, that goes right, that's actually going right within the cavity. You can see how it's pushing right into the cavity of the womb where the baby should be sitting. So just going back to that question to make sure that we've really covered it nicely. That question where we're talking about, can you get pregnant with fibroids? Does having fibroids mean you cannot get pregnant? So I was saying you can't make that kind of blanket assumption. It depends on the type and location of the fibroids. Okay, so hopefully I've covered that, and this is nicely well explained. Don't forget to like the video, and if you find this useful, please subscribe to the channel. We're talking about fibroids and pregnancy. We're looking at different issues that can happen to stress a woman if she's got fibroids related to pregnancy. So let us go to the next question. I'm just going to put it up so that you can work along with me. And so we're now looking at what happens to fibroids in pregnancy. Okay, so when you have fibroids and you get pregnant, what should you expect? Does the fact that you're pregnant make the fibroids grow bigger, or could it grow smaller? Okay, so that's what we're tackling in this question. When you're pregnant, most fibroids can cause really terrible, distressing symptoms, and that can take all our attention. But in the majority of women, they have no symptoms, and most of the time when you're pregnant, they don't grow. Most of the time. However, it can happen. I just wanted to emphasize that it is possible that nothing happens to the fibroids, but they can grow when you're pregnant. Again, don't forget the link to estrogen, the link to hormones. That's why that, and if it's going to grow, if the size of the fibroid is going to increase, it will happen usually around the first trimester, first 13 weeks of your pregnancy. And that's because the fibroids depend on estrogen. Levels are increasing because, of course, that's helping to support your pregnancy. Your body produces more of it when you're pregnant, so the fibroids will grow. And then after the babies come, the estrogen levels start to come down, then the fibroids often shrink. That's generally what will happen for most women who don't have issues with their fibroids in pregnancy. The 10 factors or 10 issues that can cause stress in pregnancy, and I'm going to take you through them one by one. So the first issue around fibroids and pregnancy that can be stressful is ability of a fibroid to prevent a pregnancy. Okay, I know I've said a lot about how many women it's asymptomatic and so on, but sometimes fibroids can prevent pregnancy and lead to infertility. There's still a lot of studies to try and work out how this happens, but if you just think about it, and let me just pull up one of my, I'm going to share screen again because I just remembered I've got a nice picture that will hopefully help us understand this a bit better. So let me see if I can actually find it. Bear with me. So let's see. Okay, that's similar. Okay, well, let's use this one. It's pretty much just showing this, the same as what I described in the last one. So you've got the ovaries here and here, yeah, and you've got the fallopian tube. Okay, so that's the relationship between the ovary and the fallopian tube, and then as it enters into the body of the womb, so that's the womb itself, the two fallopian tubes, that's the second one on this side, and then the other ovary. Okay, that's the relationship. So fibroids can pretty much grow anywhere, even if it's a fibroid that's like an outside one that's growing on the outside layer of the womb. What if it grows so large that it's able to block or obstruct the tube? So if you had a fibroid here and it grew so large that it could block the tube, now what does that mean? It means that when ovulation happens and ovulation, the egg is released from the ovary and it's making its way down the tube, follow my cursor, and up gets here, but because the fibroid has managed to grow itself so large, it's pressing against the tube, and the tubes are tiny and closing the tube, the egg cannot go through to meet with any sperm within the womb. So even that first stage of fertilization, a fibroid could interrupt it. Okay, now the other possibility, and like I said, research is still going on into how fibroids can affect fertility, but the other possibility is, have a look here, within the cavity of the womb. One of the things that fibroids does in the womb is, we say it distorts the cavity. So imagine you have a nice sheet, smooth circular area within the womb, and then imagine you start having bumpy lumps or bumpy structures. That affects the space. Okay, so let's assume that there was no fibroid here. The egg is able to nicely come down, meet with sperm, and actually fertilize. So you've got a fertilized egg. A fetus has been conceived. What's the next step? It has to implant within the womb. Okay, but if you have a fibroid that has rendered this womb, changed the structure of this womb and made it difficult for the fetus or the baby, to plant, again, that can affect fertility. So just are two examples. So it could possibly affect fertilization just because of the sheer bulk of the fibroid pressing against the tube, or if that wasn't happening, if it's the fibroid within the cavity that's made the shape or the inside of the cavity irregular, makes it irregular. The fertilized egg just can't find a smooth space where it can nicely root in and bed down and then start growing. That could cause fertility. So that's number one. We're talking about the 10 ways that fibroids can stress a woman in pregnancy. So we're talking about different conditions linked between fibroids and pregnancy. So that's one thing that fibroids can do. That's a stress that it could cause. The next thing will be loss of the pregnancy. If the pregnancy has managed to implant, if it's actually managed to get in place, but the fibroids by their very nature can grow. Okay, so even if it managed to get past fertilization, it managed to get into implantation and the baby is trying to grow, as the fibroid is also growing there, it creates a competition and that can lead to pregnancy loss. So the first one we just looked at was prevention, and the second one we just talked about is actually losing the pregnancy. So that's, we're referring to a miscarriage, for example, because we're talking about have something happening in the early pregnancy. Another issue, number 3 now, that could happen is going into labor before time. Usually we say that is 37 completed weeks. So going into labor before term. Now, the fibroid simply being in the cavity. Let's go back to that picture, which I think this picture is still up actually. Yeah. So if we go back to this picture and let's use this particular one as an example, because it's the one sitting inside the womb cavity. As it's growing bigger, assuming the pregnancy has continued, it's gone past the first trimester and it's gone into the second trimester, and the baby is growing bigger, and the fibroid may be growing bigger as well, or it might actually stay the same size. But the baby needs all the space within the womb to grow. You may have a pregnancy that is 28 or 30 weeks. So this is what happens. The fibroid can stretch the womb, make it bigger than it actually is. The womb is only carrying a 32-week baby, but the fibroid in there stretches the womb, making it look like it's 37 weeks and time for labor. So the protective plug in the cervix that normally stays until it's time for labor is lost, and that's how a woman could potentially go into labor. Even though she's not reached 37 weeks, baby is still 31 weeks. Premature rupture of the membranes. Of course, we know that the baby lives inside a amniotic sac and membranes that contain fluid. That's where the baby lives while it's developing inside mom. That sac or those membranes only burst when labor, at the time when it's time for labor to begin. That is sure. That watery discharge a woman loses when she's about, or when she goes into labor. Now, if that breaks early before the baby is ready, that can have a lot of serious problems. It can lead to infection and other issues. Those membranes are supposed to protect the baby until it's time for it to, so until it's mature enough for birth and for labor. And if that happens early, again, because the fibroid is stretching the womb unnaturally, because it's distorting the womb cavity, it can make those waters to break early, and that's another stress that can happen because in pregnancy, because of the presence of the fibroid. Number 5, bleeding before baby is delivered. Fibroids can contribute to blood loss. Fibroids can cause irregular vaginal bleeding. They can cause heavy periods. That's what they do. That's the nature of these tumors. Okay, first of all, a pregnant womb already carries a lot more blood vessels, as you would expect, because it's not just looking after itself and the mom, it's also looking after the baby. So a lot more blood supply is going to the womb when a woman is pregnant. Having a fibroid, in addition, increases the chance of even more bleeding. So that means a woman can bleed. A pregnant woman can simply have more bleeding simply because she's pregnant. The other thing as well is a condition known as placental abruption. So this is something where suddenly when a woman is pregnant, the placenta, that tissue, comes away from the lining of the womb. Now, we know how important the placenta is. It's that rich network of blood vessels that allows transfer of nutrients from the mother to the baby. So that's how baby gets nourishment, gets everything from the mom, and also things come away from the baby to the mom to help get rid of any waste and stuff. Placenta is crucial for survival. Imagine if for some reason it suddenly detaches. That can happen. It's called placental abruption. There are other reasons why it could happen, but having fibroids can make it more likely to happen. So a lot of bleeding can happen that puts mom's life at risk. Because the placenta is injured or damaged, it means that the baby too will also not get blood supply. That's a medical emergency. That's a serious complication. And I've said it can have other reasons, but fibroid is one of them. That irregular architecture of the womb, the womb that's smooth, it's not irregular, that's caused by the fibroid, can contribute to this happening. The 6th condition, I think, creates stress for women when they are pregnant, and this is about the position, the way the baby lies. This is normal. Okay, this is normal. There are no fibroids here. This is just what you normally, if a woman who is very close to term, this is how the baby would usually be lying. Now, the opposite to this is a breech presentation. So in this case, what you're looking at is a normal, we call it cephalic. Cephalic means head, but this is a normal presentation where the baby's head is pointing down, okay, and at the beginning of the birth canal. So this is the womb, and that's the cervix. So here will be the vaginal canal, okay. So this is the common, if you like, quote unquote, normal way Opposite would be the breech, where the baby's bottom is facing downwards, okay, and that can cause complications. What we usually want is for a vaginal delivery would be the head facing downwards. And of course, there are different things apart from a C-section. Of course, there are different things that you could use if the baby's head is not facing downwards. Yes, you could use forceps and you could use or different assisted methods. But what you generally want is the baby's head in this position. If something else is presenting, so we say here, this is the normal. We say here, baby's head is presenting. If something else is presenting, perhaps the bottom or perhaps the shoulder, can create complications in terms of delivery, and delivery it may not be possible to deliver vaginally, and you might need to have a C-section to deliver the baby. Why have I brought this up? Imagine if you had the fibroid. Let's go back to our picture. So imagine if you had the fibroid like this one here, growing within the cavity and sort of pushing the baby out, because that's what the fibroid does. It sort of pushes things out of the normal way. When the baby is within its amniotic sac, and within its membranes, it's swimming around, it can move around, and as it grows, nature directs it to come in the head presenting position. That's what should happen, and in some cases it doesn't. But having fibroids makes it more likely for another part to present. Okay, so if that is the situation that develops, if that is the situation that happens, you could find that the baby will lie in a way that is not easy for delivery. Okay, and that means that delivery might have to happen through C-section. So that's the sixth sort of stress issue that could happen with fibroid, a fibroid present within the womb. Now, the other thing, and the seventh issue, is when labor becomes obstructed. So then labor cannot progress. Okay, we're on number 7 now. This can be related to the one I've just talked about, when the presentation is not correct, particularly if, which is probably unlikely because you have scans during pregnancy. But in a scenario where a fibroid is in a way that prevents the baby from moving properly as it should during labor. Because what you tend to happen, let's go back to that shot. What tends to happen is, as we get to term, then baby comes lower down. As it comes to the time for labor to start, its head should come in and sit within the pelvis here. Okay, that's what should happen. What if I had one image where, yes. So what if you had this type of fibroid? What if there was this type of fibroid going on? The one here. Can you see this fibroid within the canal? So that fibroid is technically obstructing. This is just a very good example. I mean, you could even have one somewhere here or even here that could prevent the baby's natural journey into the canal. That's what this particular fibroid here, that's what it's doing. It can cause obstructed labor. And that means that, of course, it's not possible to deliver vaginally. So that can affect the type of delivery. Birth will have to be by C-section. And did you know, according to some research, women with fibroids are six times more likely to need a cesarean section. Number 8, we've talked about losing blood during the pregnancy, and we mentioned, just the mere fact that the fibroid is there. We talked about placental abruption, but now blood loss after delivery. For some women, they can deliver vaginally with a fibroid. Remember, it depends on where the fibroid is located. I've shown you so many images. That's why I shared my screen, so it's not abstract. You can see what I'm trying to explain. So for some women, even those who have fibroids that are outside, they're not within the womb, but just having the fibroid there, the risk of bleeding increases. The first thing that could happen, even if a woman has delivered vaginally, baby is okay, the fibroid hasn't caused any blockage or obstruction, and placenta has been delivered. What should happen next is that the womb starts to contract. That should happen as soon as the placenta is delivered, and that's why we give women an injection after the placenta, after delivering the placenta, towards the end of that stage, so that the womb starts to contract. It's so important for that to happen, because when the womb was large, while the baby was in there, you had so many blood vessels, all the pumping, all the blood going through to facilitate. Baby's heart rate has gone up. Why is it going up? Where is all the blood coming from? It's all this movement between the womb and the baby. Now baby is out. Now you want all this bleeding to start settling down, because if you don't, you might start having blood loss from mom. That's why you want the womb to start moving down, quickly coming down, shrinking down. If a fibroid is there, it makes it difficult for that shrinking to happen, that coming down of the womb to happen. If the womb cannot contract, it is more likely to bleed. So that's another stress that could happen, because the fibroid just being there, remember I said how it distorts things. could prevent the womb from contracting and the bleeding, because when the womb starts contracting, that means the muscles of the womb starts contracting, squeezing. They'll squeeze shut the blood vessels. So if the womb is just left and the muscles are just sort of relaxed, they're not squeezing, the blood vessels remain open and blood is flowing through. And the reason that could happen is the muscles are trying to contract, but there's something preventing them. The fibroid is just not letting the muscles to act the way they should. So that could happen. Blood, that's how you could have bleeding. And the other thing as well, I almost forgot that, if somebody had a C-section, okay, and they had fibroids and they had a C-section, and the C-section was to remove the baby, don't forget that C-section itself as an operation, a major operation, if you like, is in itself alone associated with blood loss. Having a fibroid present increases the risk of blood loss. So that as a side effect of the surgery, because the fibroid is present, that's another reason you could have bleeding after delivery. So it further complicates the issues that can happen after a C-section. Okay, we're nearly there. The next one, number 9, is pain. Pain. I mean, I really don't need to talk about this one because I'm sure you can imagine how stressful. But even fibroids, let's go back to our image. Let me see if I can find one that demonstrates this. This is just size of fibroid. It's an example of a fibroid. This is, size of a fibroid as large as a man's hand. So probably, what are we saying, 8-10 centimeters or more. Of course, fibroids can even grow larger than this. I think this one does it best, actually. Okay, so even if a woman had a fibroid, let's assume there's a fibroid that is not even inside the womb cavity. It's not even inside the cervical canal or edging towards it's not even doing all that. It's sort of sitting out there. Can you see some fibroids can have a stalk? Can you see this little pink bit here? Here's the fibroid, but here is the stalk, like a leaf with a stalk on the tree. So the reason that this is important is because this fibroid, okay, if it goes bigger and bigger and bigger, can start twisting around the stalk, okay, and that can cause pain. A lot of the problems that women can have when they are pregnant with fibroids is pain, because the fibroid twists, it starts causing cramps, causes pain. And the other thing as well, again, back to this picture of ours, is that fibroid can degenerate just like that. The fibroid goes so big, okay, the blood supply to the fibroid is not even enough to nourish the fibroid mass itself, and so parts of the fibroid start to die. We call it red degeneration. It can happen in pregnancy. It can also happen if one is not pregnant, but that it causes severe pain. One of the common causes of a woman who is pregnant suddenly gets severe pain in the abdomen or in the tummy. If she's known to have fibroids, that may be the reason, because of that change in the fibroid. Or if she's not known to have fibroids, that's one of the things that we should think about. Is this what's going on that's causing the problem for her? Right, so so far we've looked at 9 different ways fibroids can stress us out in pregnancy. The last one, but not the least important, is mental health. I can go to town talking about how all this can affect. I mean, a woman just needs to have one of these issues I've already mentioned, and you can imagine the stress. Already, pregnancy is a situation or a time of life where a lot of emotion is volatile. Is that a good word to use? Moods are up and down. There might be mood swings simply because of hormone levels, really. Okay, so one day things are okay, one day a bit tearful, one day irritable, one day simply because of hormones. Not every woman, of course. I'm just explaining what could happen. So add into the mix the presence of a fibroid with symptoms causing these problems, whether it's pain, whether it's the worry over what's going to happen when it's time for labor, and so on. So fibroids can affect a woman's mental health, can cause increased anxiety during pregnancy or labor, can affect mood, make a woman's mood low. So I thought it was really important to look at these 10 aspects of ways, or 10 ways that fibroids could potentially affect a woman. And I know there are probably a lot more, and if you've got any that you can think of, please let me know. It would be great to hear from you. But I just wanted, before I close, I wanted to share a couple more points related to fibroids and pregnancy. Okay, so having seen all these things, what do we do as doctors? How do we deal with our patients who are pregnant and have fibroids? Well, we usually just monitor and observe, just very simply. Okay, monitor and observe. I know somebody might say, well, if they could cause all these problems, why not just take it out? Because there could be risks if you're trying to remove a fibroid while mom is pregnant. And I'm not saying it's impossible, but there could be risks to both mom and baby. Lots of bleeding, lots of issues around blood, possible complications when you're trying to remove the fibroid with a growing child in place. So generally it's not done. And so what we're doing is we're monitoring a woman's pregnancy. If she needs pain relief, we're managing that and treating any complications that might arise. So very rarely, if the fibroid is so big that it might have implications for the pregnancy itself going forward, then a surgeon might need to do what's called a myomectomy, which is a removal of the fibroid during the pregnancy. Very rarely. It's not something that you would want to go into routinely. And there has been some success in some cases. I know I've gone through a report where surgeons did remove a fibroid successfully with an existing pregnancy, and the pregnancy went on. But you want to consider that very carefully, because the risks of bleeding and the risks of harm to the baby, harm to the mother, all those risks are present. What else could we do to treat? What about removing the fibroid? If a woman is having a C-section, can't you just take the fibroid out at the same time? Why not? It is getting more common. It's an idea that it's out there, but it also has risks. Remember, we've already said that C-section, major surgery, trying to manage the risk of bleeding. You want to be very careful. Risk to other organs. A pregnant womb is one that is already, there's a lot of blood vessels going on there. You want to be very careful how you handle that, and you add into the mix of that trying to deal with the blood vessels after you've taken out a fibroid. If any blood vessels are not properly closed or sealed off, bleeding can be a very big risk after that kind of surgery. So the general thinking is that the safest option is to wait until after delivery. If this fibroid wasn't addressed before, probably it could have been addressed before. If a woman was aware of her fibroids and how the position, their location, how big they were, she and her gynecologist might decide, okay, before you think of getting pregnant, for the next few months, let's address the fibroids and sort of get things. That's one way. Hormone therapy could be an option. Hormone therapy, for example, to shrink the fibroid could be an option, and then followed with surgery subsequently. So that's before falling pregnant. But if we're at the point where pregnancy has happened and there's a fibroid, the safest would be to wait. Unless there's any particular risk to the baby, the safest thing might be to wait until after delivery to remove the fibroid. Okay? What medical treatments are available during pregnancy? So limited. You can't give hormones. So what we're doing is we're giving painkillers if needed, if required. That's what we would work. And usually treatment is better before or after pregnancy. And it depends on the symptoms that you have. It depends on the size, the type of fibroids. So there you go. Don't forget, of course, surgery is not the only thing. I know I've mentioned myomectomy, but there is ablation of the womb, where because you're trying to remove all the effects of the fibroids, you're removing the inner lining of the womb. Now, this is after a woman has had her baby, and particularly if doesn't intend to have any more children, you could treat the fibroid by ablation, so removing the inner lining of the womb. There's also uterine fibroid embolization as a treatment method, is an alternative to surgery. So it's important that that's discussed, but it depends on the individual stage. I wouldn't recommend those options for a woman who is pregnant because there may be an effect on her fertility. So I think I've covered everything I wanted to look at in this topic. Important to have a look. Questions, any thoughts, any specific areas or questions you want covering, don't forget you can use our health information service to ask a question if you want specific to your own situation. Thank you so much for watching, and don't forget to give this video a like and a subscribe, and I will see you again soon. Bye bye.